Great to see such an energetic panel, well caffeinated, I'm sure, and brimming with ideas and excitement here in Aspen. I'm Vijay Vaidiswaran. I'm a senior editor at The Economist. It's my great pleasure to be your immoderate moderator for today's event, the social media slimdown, the dangers of a do-it-yourself health culture. We have seen a veritable explosion of activity online in social media in every aspect of life. But one particular area we want to delve into has to do with health information, which I know we're all quite familiar with. And this seems an apt moment to do it here on the mountaintop, here in Aspen, on the sidelines of the IDEA Festival, to tackle a rapid threat to public health, the rise of unregulated DIY kind of bad advice is spreading via influencers on social media. The digital age, let's be fair, like all multi-purpose technologies, the arrival not only of the internet itself, but social media and soon embedded in it, AI, has both good and ill with it, right? It's a double-edged sword, and it has empowered many people who might have otherwise not have access to medical information, and in many ways led to opportunities to learn about health and treatments. But we also know that thanks in particular to social media platforms and the incentives therein, we're seeing the spread of challenging information, often misinformation, often by people with dubious credentials, sometimes even posing as those who are credentialed. And this reaches deep into our pockets, deep into our lives, especially of younger people, and making a personal connection in a way that we know social media does. And in a way perhaps that might keep them from getting professional advice or doing the homework themselves to figure out the harder job of what good medical advice is on topics like obesity. So this is an area that we want to get into, to challenge and see what are the opportunities, what does the research say? And I have some terrific experts in this area that we're going to bring on stage in just a moment, but also to go beyond misinformation, to talk about real world health consequences and the erosion of public trust in medical professionals and science care. I want to thank Lily for sponsoring this session and the research in this area. And this is part of a much broader initiative by Economist Impact, which assesses the readiness of policy, health systems, and society, both globally and at the US state level, to address obesity and in particular, to reduce stigma. As part of this, we'll now watch a short film called Living with Obesity, Stories Behind the Statistics, which spotlights Vanessa, who lives in Mexico. She shares her experience balancing a demanding career with her personal journey. So please, let's watch the video. Thank you.
Soy Vanessa Hernández, tengo 41 años, soy mexicana y vivo en Querétaro. Soy ingeniera en sistemas y modelo plus size. Toda mi vida he vivido con obesidad.
According to the World Obesity Federation, over 30% of Mexican adults are living with obesity. The Mexican government has taken action by recognizing obesity as a disease and acknowledging its links to other chronic diseases.
El tema familiar siempre ha sido un problema, el sobrepeso. Mi papá, por ejemplo, él murió de diabetes. Mi mamá tiene diabetes. Tengo varios problemas de salud: diabetes, hipertensión, endometriosis y hipertiroidismo.
The way we tackle obesity also needs to reflect our understanding of the disease and its genetic, social, psychological, and environmental causes.
Yo creo que 90% de mi problema de obesidad es genético. El otro 10% también en mi vida sedentaria. Yo soy project manager, entonces tengo muchísimas responsabilidades. Trabajo frente a una computadora más de 10 horas.
Que fue lo primerito que nos mandamos.
Manejo muchísimas personas, tengo que coordinar entre proyectos, pero también metas. Casi no tengo tiempo para priorizar mi salud y me genera mucho estrés, la verdad.
Legislation protects people from discrimination based on physical appearance, including weight, paving the way for a greater understanding of this disease and the people living with it. Vanessa has found working with a psychologist has enabled her to have a more compassionate, forgiving, and positive view of herself.
Hola. Actualmente estoy trabajando con una psicóloga que me ha ayudado mucho a comprender la enfermedad que es la obesidad.
No depende nada más de solamente un factor, sino va más allá de lo genético y de la biología. Incluye factores.
Soy Vanessa Hernández, tengo 41 años, soy mexicana y vivo en Querétaro. Soy ingeniera en sistemas y modelo plus size. Toda mi vida he vivido con obesidad.
According to the World Obesity Federation, over 30% of Mexican adults are living with obesity. The Mexican government has taken action by recognizing obesity as a disease and acknowledging its links to other chronic diseases.
El tema familiar siempre ha sido un problema, el sobrepeso. Mi papá, por ejemplo, él murió de diabetes. Mi mamá tiene diabetes. Tengo varios problemas de salud: diabetes, hipertensión, endometriosis y hipertiroidismo.
The way we tackle obesity also needs to reflect our understanding of the disease and its genetic, social, psychological, and environmental causes.
Yo creo que 90% de mi problema de obesidad es genético. El otro 10% también en mi vida sedentaria. Yo soy project manager, entonces tengo muchísimas responsabilidades. Trabajo frente a una computadora más de 10 horas.
Que fue lo primeritito que nos mandamos.
Manejo muchísimas personas, tengo que coordinar entre proyectos, pero también metas. Casi no tengo tiempo para priorizar mi salud y me genera mucho estrés, la verdad.
Legislation protects people from discrimination based on physical appearance, including weight, paving the way for a greater understanding of this disease and the people living with it. Vanessa has found working with a psychologist has enabled her to have a more compassionate, forgiving, and positive view of herself.
Actualmente estoy trabajando con una psicóloga que me ha ayudado mucho a comprender la enfermedad que es la obesidad.
No depende nada más de solamente un factor, sino va más allá de lo genético y de la biología. Incluye factores psicológicos, ambientales, económicos, hasta familiares.
Me gustaría escribir mi propia historia, no repetir los patrones de mi familia. He estado haciendo pequeños cambios positivos hacia mi rutina y eso me pone muy feliz. Ha sido mi fuga.
1, 2, 3.
Mi lugar feliz.
5, 6, 7.
Entonces, un lugar en el que puedo ser libre.
Tienes Vane. Muy bien.
Vanessa has also found a sense of empowerment in being a plus-size model. She enjoys being a role model, hoping to help others feel comfortable and confident in themselves.
Mi sueño es poder tener una vida mucho más saludable, sentirme yo en paz, que no me dé miedo ser juzgada por los demás y sobre todo el hecho de mi bienestar, ponerlo como prioridad. Me entusiasma mucho el futuro, ya quiero saber qué va a venir después.
To the stage, Professor Timothy Caulfield, who is a research director at the Health Law Institute at the University of Alberta and an expert on social media and health. Welcome. Please give a nice round of applause. Welcome, Tim. So this is an area that you've studied for many years, using different kinds of tools. Can you give us a sense of how you see health misinformation evolving? Because, I mean, let's remember, right? Snake oil salesmen have been around for centuries, right? So there's some basic need that might be being met by peddlers, and shamans. So tell us what's new here. What do we need to be aware of?
Yeah, no, you're right. Health misinformation has been with us forever. I think forever. As soon as humans started communicating, I suspect there was health misinformation. But let's fast forward to right now. It's a crisis, Vijay. It's a crisis. It is killing people. And you're right, I've been studying this really for decades. And I've never seen it as bad as it is right now. And it's getting worse. This is grim. It's getting worse and worse, kind of with each, it's worse now than when this event started. I'll put it that way.
Yeah, give us some points of reference, some evidence here.
Yeah, so let's just talk, of course, social media has played a huge role in changing the nature of health misinformation. And the other thing that we've seen, a profound kind of normalization of pseudoscience happening, not just in the United States, not just in Canada, but really around the world. And it is hard to study this well, so you do have to use a variety of methods to do it. So there's always that caveat, I think, be careful in how you interpret this data. But let's just talk some of these numbers, okay? So there's been a study that came out of Australia, found that about 60% of the health and wellness content online misleading or just total bunk. We did a study on cancer books about cancer found on Amazon. And we found about 50% of those books were misleading. And by the way, our coding frame was very conservative. About 50% of the books misleading, or again, total bunk. And on the first page of your search result, 70% of those cancer books, right, misleading, full of bunk. Very recent study came out on mental health issues, found that about 50% of the content online, especially on TikTok, 50%. Misleading or problematic.
And just to be clear, the baseline you're comparing against is peer-reviewed science published in accepted medical journals and so on, or is it what's the standard you're judging by?
Yeah, so one of the things that we often try to do at the Institute, because we can have an interesting conversation, and people in this room might even be thinking about this already. Who defines misinformation? What is misinformation? So our team, and I think a lot of teams do this, they choose things that are demonstrably false, right? As the reference point, something that's demonstrably false, because we can have, science is hard, especially in biomedicine, right? We want those interesting conversations.
I mean, there's emerging science,
exactly,
gray areas. So you took very conservative definitions.
Yeah,
definitely. And what you and other scientists have found in this area, data scientists, is that there's a lot of misinformation, misleading information, even dangerous information.
Yeah, and I think it's important to recognize, and I think we'll come to this, so much of the content is not created by experts. I was just looking at a study recently that found that was looking at, skincare, anti-aging, dermatological information online. What percentage of that content do you think is created by MDs, by actual experts? 5%, right? So that gives you a sense, right? So much misinformation, so much of that misinformation is coming from individuals that really don't have the expertise to be talking about it. So that is just a significant shift. And unfortunately, we also know, research consistently shows, that it's landing, Vijay. People are, they're believing this. It's having an impact on health perceptions, health beliefs, having an impact on consumer behavior. It's creating more stigma. It's creating more anxiety. It's creating more fear. I recently wrote a piece where I argued that we're living in a fear-demic, because so much of this content that we're seeing online is propelled by fear and rage and grievance, because the algorithms that create our information environment, that's how they survive.
You talked about stigma. I want to see if we can pursue one topic to get a little more detail, because at The Economist, we always press for examples, for detail to come down from the 30,000 feet. There's a lot of stigma associated with obesity in particular. And often young women and girls are targeted in terms of marketing and societal expectations. Now, 'twas ever thus, right? That we can go back to, or through the centuries. But with the current concerns of social media, of the way that maybe even AI and algorithms and platforms are operating, can you talk about how this is affecting the conversation about obesity and what that's leading to?
Oh, well, I think the data now, we have a good, rich body of evidence to support your concerns, BJ. And first, let's talk a little bit broad. We know that exposure to social media platforms can create mental health concerns. We also know, by the way, a very recent study showed that problematic social media use also leads to more embracing of misinformation generally, but health misinformation too. So it's this vicious cycle, right? That you get pulled into social media, especially young teenagers, young adults. And it creates, it has an impact on their mental health generally, but also on their perceptions of themselves. Let's be honest, social media is a massive FOMO machine, right? It's a massive comparison machine, right? People are telling stories, and stories about individuals can be very persuasive. There's really interesting research, and we've done some research in this space, how an anecdote, a testimonial can overwhelm our ability to think scientifically. So you have, one scary, compelling anecdote versus hundreds of millions of data points, and that anecdote's going to win, right? Especially, VJ, if it plays to that person's values, maybe speaks to this, a celebrity that someone, speaks to their interests, someone they look up to. We know research tells us that it increases the anxiety in the individual, but to your other point, it also has an adverse impact on social perceptions, hence the stigma problem. On the good news side, I think it's also important to recognize that social media can play a positive role. So, I think how we think and talk about obesity, so much more improvement's necessary. It's absolutely necessary. But since I've been working, I've had the opportunity to work in the obesity space, you have seen an improvement. Definitely how clinicians talk about obesity. Yes, more improvement's necessary, but how I think policymakers and health systems talk about obesity, that's a good thing. And that's an example.
Well, we had the example of Mexico just a minute ago in the video, didn't we?
Absolutely. And I think that's a really good example of how, let's not be too, depressed about this story.
Yeah.
Good science communication can make a difference.
And you have a particular initiative that I want to hear a little bit more about on the positive side of this. Can you talk a little bit about your volunteer effort to try to combat bad information with good information, if I understand it correctly?
Yeah, that's right. So we have an initiative in Canada called #ScienceUpFirst. Now, I started this with Senator Stan Kutcher. He's a physician, but also a senator in the Canadian Parliament. And we started this initiative. Now I'm just an advisor on it. We have these wonderful young creative minds that are running this, experts. And we made the decision to create positive content. We partner with communities, so obesity community, Indigenous community, immigrant communities, to make content, co-create content with those communities that's positive, that is accessible, that is engaging, and in Canada, it's been extremely successful, and it's independently funded, independently vetted, and I hope that is the kind of content that we can see more of.
And how do you go up against some of these mega platforms, TikTok and Instagram, or perhaps the most influential in spreading some of this information, when there is a fundamental commercial and algorithmic bias that's working against you? You've got a handful of government-funded or even volunteer researchers. It sounds like a people's army, but you're going against some pretty powerful Silicon Valley and Chinese monoliths.
Yeah, you can already see the expression on my face. It's incredibly difficult. It's incredibly. We're not only. It's even more dire, right? Because we're not only fighting against those social media platforms and the search engines. I think we're fighting against the broader information environment that has similar incentives baked into it, right? The incentives are to play to people's emotions, as I said earlier, right? And for example, there was a recent study that came out late 2024 that found, listen to this number, 75% of the content that is shared without clicking through. 75%, right? And that's because people are responding emotionally to the headline, to the meme, to that message, and to their politics, to their grievance, to their fear, and they want to share, right? So, of course, the algorithms drive that. That's exactly the response.
They want virality. Right?
Yeah, that's exactly the response they want, right?
Right.
So when and that impacts not only the individuals who are sharing it, but it impacts everyone because it creates our information environment. And by the way, that's also starting to impact how the legacy media reports and how they handle things. So it's not just the social media platforms that are problematic. I think it's really the broader information environment that's challenging. We can't give up. Whenever I have the opportunity to talk to organizations like yours, the message is create good content, get out there, share it, and I think we should lean into being positive. Let's try to avoid. Let's be positive. Let's be nice, right? And let's try to make content that's going to have enduring relevance.
Do you think that scientists and medical doctors are equipped to engage in the public discourse? I mean, isn't there a reason influencers on TikTok appeal? They have the dances, they have the lingo. You're kind of a nerd. I mean, I love you, but is it really going to work to have more nerds online?
The short answer is yes. Because it's good, once again, VJ, a good news, bad news
We
story.
haven't seen your dance yet, but
You
if
do
we
not want
play
to
our
see me
cards
dance.
right, Tim might give us his TikTok dance later. But
You
carry on.
You don't want to see me dance. It's a good news, bad news story. Because the good news is, I think that we are seeing more creative individual, people from different communities, diverse communities, create really powerful stuff online, engaging, fun. That's a good news story, and something I've monitored really, really closely over my career. And I think we're also starting to see a lot of scientists and MDs, and so they're colleagues of mine. The science communication space is starting to get really exciting. So that's good news. That's good news. I think we might even hear from one later on.
Yeah, we have a wonderful panel coming up in just a moment. We'll hear from
exactly right. So I think that's good news, right? But the bad news is you're exactly right. We know, and again, research can, we're doing some research on this right now, podcasters, influencers have an outsized role because they play to our psychological, our cognitive biases. They play to what we want to hear. They create that content that is going to land. So it is a tremendous challenge, but just because it's not a tremendous challenge doesn't mean that we shouldn't, step into this fight. Research consistently shows that the tools that we'll hopefully have a chance to talk about, they make a difference. It may not feel like it because there's just, it feels like you're holding back the tide, but it does, pre-bunking, debunking, accuracy nudges, good fact checking.
What does that mean? Can you tell us a little bit about that? Because I know I saw some recent research out of MIT on how to persuade people with extreme views on one side or the other. They were talking about politics in that case.
Yeah.
Are there tools from your research that could help in our conversation about health, about obesity, for example, on if people have either extreme views or they perceive you to have an extreme view? How do you handle that?
Yeah, that's really exciting research. Research, by the way, that's been replicated by other laboratories. That's work by people like Gordon Pennycook at Cornell and David Rand, who's at MIT.
Yeah.
And they've done a lot of really interesting research in this space. And they found two things. One, this idea of an accuracy nudge, right? If you can just encourage, and that speaks to that 75% number I talked about, right? If you can just encourage people to pause, even for a moment, take that beat, less likely to believe misinformation, less likely to spread misinformation. But they've also found that you can create chatbots, for example, that can pull people out of the rabbit hole, right? By providing them tailored information that's relevant to their preconceived notions, their beliefs. So there are these tools emerging, these evidence-based tools. This is one of those situations where we need to come at it from every direction, right? It's not going to be one tool that's going to fix this. This is a generational problem. We have to teach critical thinking skills, media literacy, and we have to do that across life's course. We have to do all of that in a way that this is a problem that's not going away. I fear it's only going to get worse.
Well, it's a sobering thought, but I appreciate the fact that you did highlight some points of good news and certainly opportunity, and that's really where we're going to delve into with our expert panel that's going to come up in just a moment. So if I might actually ask us to just take a moment to rearrange the stage, and we'll have a few chairs brought on, and I'll introduce our panelists in just a moment. Why don't we take this moment to do an audience poll? Hands up, how many of you have Googled for some health information sometime in the past? Okay, this is for those of you online, every single person pretty much. And keep your hands up. How many of you found some questionable information when you Googled and you were left a little bit uncertain, right? Okay. Now, if we move this on to the more modern conversation here, how many of you have maybe paid attention to a social media influencer or been targeted by social media health information on diet or any other beauty creams, anything else? Okay, a lot fewer people, but still a decent number. And this is a pretty savvy Aspen Health audience. And again, hands up, how many of you think you've encountered kind of bogus information from health influencers online? A much bigger variety of you who have just tuned it out. So that's the kind of sophistication we're hoping we can get to when we think about dealing and consuming content. We live in the age of social media and increasingly of AI. We have to be more sophisticated and educated consumers of it, and in particular, educate those in our lives who might be vulnerable, especially younger people, as they grow up digitally and AI native, how to perceive and detect what are authoritative sources of information versus some of the bogus sources of information. To help us think about that more thoughtfully, I have, as I said, a wonderful group of practitioners and experts I want to introduce on stage. I will introduce them, then ask them to come on stage. Rocio Salas Whalen endocrinologist and owner of New York Endocrinology. Rhonda Pacheco, Group Vice President for U.S. Cardiometabolic Health at Lilly. Allison Grupinski, Clinical Psychologist, National Center for Weight and Wellness. Please give them a nice round of welcoming applause, and I'll invite Tim to come back and join us as well. Thank you.
Good morning.
Welcome, everyone.
Hi. Thank you.
Rocio, let's start with you. Now, you are both a medically trained doctor, but also someone who's active in social media. Tell us, what led you, as again, a conventionally trained, Hopkins-trained doctor with excellent medical credentials, multiple credentials? You could have led a life in the Stone Age and been quite successful without encountering the world of social media. What led you down that path, and how do you pursue what you do online? Because you're quite active there.
So my initial reason going online on social media was because I opened my own private practice. So it was a way of advertising myself, but very quickly it turned a different way. It became more educational. COVID hit. I'm also an obesity specialist. So with the availability of the GLP-1 medications, COVID bringing a huge light into obesity as a disease, it became as a way of informing people. And I understood, and I understand now, that my platform, I can reach much more people than what I can do in the one-to-one with my patients. And I love what I do. I love my profession, but definitely the education part and the response that I've gotten from the audience has been huge, right? So to this day, my social media 100% is due to information. And being in such a niche of specialty, being an endocrinologist, being an obesity specialist, having more than 15 years of experience working with GLP-1s, put me in a very special place that not everybody has the same information and clinical expertise that I have. So again, this is a way that I can reach much more people than people that have access to me as a one-to-one physician.
So that explains motivation, which makes perfect sense. But tell us how you do it, because there are some limitations to social media. It's visual, especially with younger people. The format is shorter. Nobody wants to listen to it, even though I'm sure you're incredibly entertaining. 30 minutes of medical discussions on TikTok probably isn't going to fly. So how do you adapt intelligent and medically correct content to be digestible, to be snackable by, again, people who are not medical experts, but rather grazing, as we all do on social media?
I mean, definitely making it in a way that lay people that are not in the medical field understand, right? And I think being also relatable helps a lot. I'm in my social media, I don't know if anybody here follows me, but when I started, it was just medical information and of my specialty. But I was struggling with depression. I was going through perimenopause. I was going through a divorce. And the more I shared my own experiences, it became more relatable, and people related more to me as a person and not just as a medical expertise that is just telling you all this medical information. So I think it's key that you keep it real in social media, that you do it yourself. I do all my social media myself. And I share my life as a human, right? I was really afraid of sharing that I had major depression as a doctor, as a bias. And as a physician, I was, oh my God, patients are going to think that I don't care for them, right? Are my superiors or my colleagues going to think that I shouldn't be practice medicine? And it became so normalized in my patients, and people reach out to me and they say, thank you. Thank you for making this normal. Thank you for telling us that you as a doctor have depression, right? And it makes me a better doctor, admitting that I have depression and I get treated, right? And the same with obesity, and same all the other bias in certain diseases that we have.
That's a powerful testimonial. What I'm hearing is the authenticity of what you're doing is really what connects with people.
Definitely.
And that helps them take on board the medical information you're giving them, of course, as well as your credentials.
Definitely.
Because we know, and we'll hear probably more from Tim, but the numbers I'd seen is, I think in the UK, only 1 in 9 of the supposed medical experts actually had medical credentials when in giving medical information of various kinds on TikTok or Instagram. And so you're out there in an ocean where 8 others roughly speaking, will pretend to be doctors or claim some credentials, trying to give people supplement information, click here and buy, I presume is what you're up against.
100%. And I have to play devil's advocate too, but one of the reasons that I can spend this time and do it responsibly is because I have my own private practice, right? I can manage my own time. But for the majority of doctors who are seeing 30, 40 patients a day, which is the reality in our country, it's very hard to ask them, and also run a social media platform, right? It's staying here. It's something that now we doctors have to debunk and go against or against the misinformation. But in reality, not every doctor has the time to really dedicate themselves and do social media responsibly.
Yeah.
It's a problem.
Well, thank you. That's a good start to our conversation. Rhonda, maybe we can turn to you.
Sure.
How do you see this challenge? I know that your firm has actually invested in advertisements to try to take on some of the vanity applications that people are using medications for, some of the innovative medications. How are you coming at this challenge of medical disinformation and maybe inappropriate uses of medicines?
Yeah, one thing we talk to a lot of patients, and we hear the same thing. I think what you're talking about is patients being able to relate. And I do think that's why they go to social media. The other big thing that we find from patients also is they've gone to the doctor. It's hard to talk about their weight, and they don't. In fact, some doctors, not this one, but some have also, there's judgment there and bias. And so there's a lot of that comes out, and we're really trying to, on social, you'll see us a lot on social, but having patients talk about this. They don't want to listen to Big Pharma. They don't want to listen to me. They want to listen to relatable patients. And that's how we're trying to also get our message out so they can relate to the patient. The patient has that information and can give them reliable information. And again, it's that relating to what they're dealing with and not that stigma or that judgment that they have already felt and seen. And that's the big thing that's motivating us to get the story out.
What are the challenges in that approach? What have you encountered, whether it's with physicians or with patients? How are you getting that message out there?
It's one step at a time. I think we heard Tim talk about that. It's overwhelming. It gets worse every day, and so it's just we're motivated to continue to do it, and you just can't stop, because if you can reach just one patient every day, it's just one patient more. But I think that's the biggest thing, is getting to everybody and competing with all the noise. There's so much noise right now, and there's a lot of money in this space. And so I think that's driving a lot of people into this space. And so we just got to keep.
I mean, to be fair, you're making a lot of the money in this space also. More people want to get in on it.
But a lot of patients too. So that's what motivates me.
I understand. But give us an example of some of the harm that you see, a concrete example, just so we understand what you're trying to go up against.
Yeah, I don't want to call one out. There's just so many, but like the fad type diets, like something that's just super simple and just do this one thing and you'll figure it out.
Quick
it's not
fix or trick. Yeah.
What we're trying to do is, again, it's that stigma and bias. It's not your fault. And I think when you talk to these patients, and I'm sure you've talked to many, many of them, they blame themselves. And so that's a big part of, it's not just one fad diet. It's not one thing that you've done wrong in this judgment. This is biological. Like you've heard from Vanessa on the video, this is genetics. Like this is multifactorial. So don't blame yourself. And that's the piece that you'll see in social that we're just really trying to attack. It's not your fault. And this is a disease. Don't blame yourself.
Yeah, we do really need to think about it as a multifactorial.
Yeah, I mean, definitely we know that obesity is chronic, not curable, multifactorial disease that about 40 or 50%, it can be hereditary, right? So when you tell that to a patient, it takes a huge load off their shoulder. But going into what Rhonda is saying, I think it's a vicious cycle, because unfortunately, many patients that have great results, which is the majority when it's followed, it's done with proper supervision, talking about a GLP-1 and obesity is that we don't hear the positive stories. We don't hear all the good things that happen on these medications. What we hear in social media is all the bad things, right? Which can be extreme, and that's usually done by improper supervision of the medication, because the medications itself, they're great drugs. And I'm not here, I don't work for pharma, I work for my patients, but I see that how life changes. But even patients that I have in my private practice, they said, oh, my husband doesn't know that I'm on these medications. Oh, I don't want to tell anybody. Everybody's telling me. Some people say it was my nutritionist. I just changed my diet. So we're continue to fuel that bias instead of saying this medication has worked great for me, because the negativity is what sells, right?
That's a good moment to come to Allison. Allison, you're a clinical psychologist, so you deal hands-on with perceptions, with these sort of emotional challenges, societal imprints and stigmas. Now, we've heard already that a challenge like obesity, it's multifactorial. There's a genetic component, but we know there's social, cultural, economic determinants of health come into play as well. How do you counsel the people that you see, and what sort of the trends that you're seeing that you'd want to bring to the table here for our conversation?
A huge part of what I talk with patients about, and so I specialize in obesity as a psychologist, which is pretty unique, pretty unusual. There are others like me, but not a lot, and I think we need a lot more. The intersection of mental health and obesity, but also just health behavior change, is really complex. Everybody, I think, can relate to wanting to change their behaviors, to wanting to get healthier, and then feeling like you're just constantly bumping up against a wall. And that does something to us. And that's a huge part of what I talk with patients about from the very beginning, is the fact that the struggle that you've had, whether it's related to, I specialize in weight management, but it's really health behavior change. So whether it's related to how you're eating, the way you're moving, managing stress, managing your sleep, whatever it is that's going to help you get better, if that's something that you've been struggling with for a really long time, the narrative that's out there in the world that we live in, and we've been hearing this a little bit, is that it's your fault. If you would just work harder, do it better, find the right program, find the right influencer, find the right solution, find the right cure, then it would all be better. So the overwhelming bias that is out there, people internalize, and they internalize that bias, internalize stigma, feel like this is actually my fault, and therefore I need to work harder, I need to try more, I need to find the right answer, and I certainly shouldn't. I because it's my fault, I feel ashamed about it. So that's not something that you necessarily talk with somebody about in a very first session, but over time, that's really a kind of a level setting that I like to do with patients, because until we can sort of really look at what it is, like the context that in which we are working, it's really hard to make much progress. And that can be, I think it was to Rosia's point earlier, very, very freeing once we get there.
You bring up an important point that is, particularly certainly in Western society, certainly in the US, there is a strong bias towards rugged individualism, sort of self-empowerment, pull yourself up by your bootstraps. If something goes wrong, it's your fault. Eat less, do more exercise. It's hard. And certainly there's great virtue in that also. But I think what we're understanding about a challenge like obesity and some other health conditions is there are complex factors that we need to take into account. And banging your head against a wall and seeing yourself as a failure, it sounds like, is counterproductive to everyone.
It's counterproductive. There's actually data that suggests that it actually makes things worse. And so it's completely counterproductive. You can hear a lot of tough love, that's what's going to help, et cetera. It's the opposite of what helps.
And are there particular groups you find in society that are susceptible or vulnerable to this? I mean, we've hinted at this a bit, but this is your life's work. Can you give us a sense of who you find most at risk?
For what I'm talking about right now, I would argue in terms of just this internalized blame, et cetera, I would say that's an everyman problem. To speaking more about social media and trends and wellness trends, I think we'll talk a little bit more about that. But I particularly worry about vulnerable populations, young girls, underserved populations, populations that maybe have medical challenges that just have, for whatever reason, haven't been researched very well. There aren't good solutions for. But the internalized blame and shame, all of that, particularly for people with chronic medical conditions, obesity, really doesn't discriminate. And interestingly, a lot of the sources that data tells us that sort of stigma comes from. It comes from family and friends, the way we talk, to our children, to each other. It comes from medical professionals, and so it's certainly widespread in the media. So all of those things affect all of us.
Yeah, Tim, you've heard from our three practitioners here. What's your perspective from the ivory tower?
I just think this conversation is excellent. I mean, so many great comments, and I want to hammer on that theme that's emerged from all three of my colleagues. And this is this idea of putting the blame on the individual. And I think it's really important to emphasize the degree to which that's happening on social media and in pop culture. Still, I mean, this has been a problem for decades, and we're still doing it. And I think there's some trends now that are making it worse, and you touched on one of them. Let's be honest, there's a political identity associated with this now, and I'm not trying to be partisan at all, but a lot of these conversations are rooted in politics. It's your moral responsibility to be fit, right? And if you're not, it's your fault. It's not socioeconomics, it's not bad luck, it's not the parents that you picked, it's not any of those things, it's your fault. Right. And that's a horrible, and we know it's just deeply, deeply wrong. Right. And it doesn't lead to constructive solutions, as Allison pointed out. The other thing that I think we shouldn't, leave to the side is the role of aesthetics. You look in these I've done a lot of research in the manosphere, and all of these influencers, BJ, do they have their shirt off while they're talking to you? Yes, they do, right? It's so they, imply it's not about health. It's about looking a certain way in the very near future. It's not about long-term sustainable health and a good life. And I do also think the manosphere is worth just touching on briefly. When I use that word, do people know what I mean by the manosphere? The manly man. So I did a documentary on this recently for the CBC, and we're doing research around it. This is a really powerful trend, pushing a lot of lies about health, about ridiculous diets, about the carnivore diet, for example, drinking your own urine. Don't do that. If you remember one thing from today, don't drink your own urine.
Do coffee enemas. Don't drink coffee enemas.
All right, you can use, folks. This is what we're here for. Okay.
Even when I raise when I say the word manosphere, I bet a lot of images that pop up in people's head is a guy with tight haircut, a beard, lifting a kettlebell, right? It's all about aesthetics. It's all about presenting yourself a certain way to society. And if you're not doing these things, there's something. Not only is it your fault that you look a certain way, it's not. This is a noble pursuit. You're less of a person if you're not doing these things. If you're not doing a cold plunge, and if you're not getting up at 4 a.m., and if you're not on a carnivore diet, these things really shape how people think about health. And the other thing they do is they foster a distrust, because that's one of the goals. They want to create distrust in pharma. They want to create distrust in conventional healthcare doctors. They want to create distrust in the healthcare system, and they want to create distrust in the scientific community. But because by fostering that distrust, it makes room for their narrative, and it disempowers the narratives that are coming from those communities, right? And so,
how much of that is driven by a profit motive? That is because people are peddling some, nutraceutical or something else. There's some commercial angle, as opposed to something else, just an agenda of clicks or being an influencer.
You're gonna hate my answer. It's all the above. I call it the misinformation continuum, right?
Okay.
On one end, you have the disinformation people that clearly know. Sometimes they're state actors, right? Think of the misinformation around COVID. A lot of that, state actors driven. So they clearly know it's a lie, and they're spreading it to create information chaos, to create polarization. And it works, right? And this happens in the health. It's not just in politics. This happens in the health space too. Move along that continuum, and you have some influencers, and I'm fascinated in this question. Do they really believe their nonsense? Does Gwyneth Paltrow, can I say that? Does she really believe, does she believe it? I don't know. Does she think the jade vagina egg really works? I don't know. You move along that she just wants to sell products and create a brand. And then you move along it further and you have the individuals that just want to do what's best for themselves. They want to do what's best for their family and community. And they're inadvertently sharing it. All of that does harm, and all of that requires a specific response, different kind of response, psychologically, right? But also from a regulatory perspective. But I will say the profit motive looms large. Obviously for the platforms, right? They benefit from the spreading of misinformation. It looms large also for the influencers who make so much money. A huge red flag is the marketing of unproven supplements. Massive red flag. That's not to say that everyone who sells a supplement is a quack, but it's definitely a huge red flag. It sort of funds this entire industry.
This is a question for all of you. What change would be helpful in how the technology platforms operate, right? Because that's the connector of a lot of the stuff out there that we're talking about, and the individual through the phone I have in my pocket, right? The most personal thing in my life is that we're all addicted to. Is there a change that would be helpful, or do we think that this is really something that we cannot fight? I'll give each of you a chance to offer a thought.
I mean, in regards to my profession, the medical profession, it will be hard to regulate every physician, right? I mean, that you have to regulate everything. I think it's easier to educate the public, right, on how to listen, what medical information we put, versus having to filter all the medical providers and healthcare providers that are putting in social media, because number one, there's not enough of us doing the correct information or doing it responsibly. I think, and that's one of my objectives of my social media, is that this platform is easier to educate the consumer than to really get more professionals on it, right? I think education is powerful, and then you can advocate for yourself. So I think it's more educating the public to be an informed consumer, to be an informed consumer when you are consuming this social media information, right? And you have to know that we doctors, we're not giving direct personal recommendations. We talk in a very broadly, and if we choose, and I can speak of myself, I choose subjects that are going to be more generalized, right? Like, let's talk about obesity, let's talk about medication for obesity, osteoporosis, whatever it's the discussion of the day, but it's not a direct medical recommendation for you as an individual, and you have to know that.
Rocio? Rhonda?
A little bit of a different angle here, but I do think access is a big part of some of the things you're seeing online, and people don't have access to real medications, and so you'll see a lot of fake stuff out there. And so I think the policy is probably the biggest thing that I'm in the fight for. And so how do we get policy changes that access to these medications is critical? We're in that fight, and we need everyone to be part of that. But I think if that changes, I'm big on this will open up the access and more affordability for patients.
And again, I'm reminded by an advertisement that your company put out about, and the European Medicines Agency also had pretty much a similar line, that some of the new innovative medicines should not be used just for vanity, just for cosmetic reasons. So even policy changes that allow more access won't allow this to be like popping vitamin pills, right? I mean, there's a line that will never be crossed, so there will always be demand that can't be met. And doesn't this suggest that maybe there will always be a room for third parties offering, these sorts of solutions?
Of my social media, I've gotten multiple messages, and they send me fake people are pretending to be me and selling medication, right? So that is not regulated, and that's something that needs to be changed, both in TikTok or on Instagram. And actually, I had people call to my office and say, I never received the medication, and we have to tell them, unfortunately, that was not me.
It was a scam.
Right? It was a scam. So I report them to Instagram. And there's so many walls. Like we found somebody in the middle of Nigeria pretending to be me and selling medication, right? And we couldn't do. And he said, "If you close, I'm going to close it, but in 2 weeks I open a new one."
Was he a prince? He's on to the next scam. Alison, how about you? Anything that comes to mind in terms of the fix on the platforms?
I think, solutions like the science up first, incentivizing ways to embedded already in the algorithm and platforms, we are incentivized, all of us, is to create content that's going to create clicks, right? So how can we help people who have expertise create that kind of content? And so that's why I love, campaigns or projects like that. I think the more that we can flood social media, I mean, again, I think you use the example of, it sort of feels like you're just holding back the ocean, but it's, but there's also a lot of, I'm seeing a lot of shift and a lot of good that's coming out of that kind of work. And, unfortunately, as, Rocio, as you were saying earlier, a lot of physicians, psychologists, dietitians, folks that are in this space who really do know what they're talking about, who actually might be hilarious and creative, they may not have the time to do this kind of work. So can we also help incentivize and, create pay structures, et cetera, for places that they're working to be able to create that time and space for them? I just recently saw a good friend of mine who's a very well-known, person in the nutrition space, just create this 30-second post that was so powerful. And she just gave this really quick, she kind of gave one of those bait headlines that said, here's 3 reasons why I'm able to stay fit, while I'm a working mom. And it was the opposite of what you would think. She talked about the fact that her genetics work for her, that she has privilege, that she has, a husband who has time to actually take care of the kids. And it was so powerful. It was things that we know about, that all of us sort of know in our heart. But hearing somebody sort of use that brutal honesty, who has this expertise and, did this in a very short but creative way, really made an impact.
Tim, how would you take on the platforms?
Yeah, I love that, and I totally agree that we need to treat good SciComm as something you don't do off the side of your desk.
Right.
Institutions support it, institutions incentivize it. I totally agree with that. Yeah, Vijay, I absolutely think the platforms can and should do more. We know, I know it doesn't feel like fact checking works, right? Community notes is one tool that may add to it, but we need to do more on the social media platforms. That's not going to happen in this political environment. There's just no way. Zuckerberg, I can go directly to his claim when he decided to kill fact checking, that it doesn't work. That's not true. Yes, we need to learn more how to do it better. There's unintended consequences.
Tim, you're Canadian. Your research institution is Canadian. Well, we Americans like to think of Canada as a kinder, gentler neighbor to the north, maybe with more paternalistic nudge impulses than we would tolerate in sort of red meat-eating America. Don't you have tools at your disposal from your government to take on the platforms, or you also have the same challenge?
Same challenges, and I think that.
Why is that? That would suggest maybe the policy can't help. Is where I'm going with this.
Yeah, I do think so. In Europe, as you probably know, you are seeing more action, but a lot of the rhetoric in the United States has had an impact on Canadian politics. Believe it or not. The Florida Panthers beat the Edmonton Oilers, and your misinformation is having an impact on our politics too. So I think, for example, the idea that the conversation we're having today is somehow about censorship and about curbing freedom of expression and about silencing people. That's just simply not true. But that rhetoric is very powerful in a political sense, right? Sort of on the contrary. Everything that you've heard today and all the research we do is about empowering people. It's about the marketplace of ideas. It's not about censorship. And in fact, a lot of people, when you hear about misinformation, especially with MDs, people think, oh my God, so many MDs were silenced or they were sanctioned. There was a study that came out, JAMA, very recently that found it was the least common reason for getting a censorship being regulated by your regulatory body. It almost never happens. It's the same thing in the United States, but the perception is people are out there trying to silence doctors.
Well, I have to say, my account was deleted. My account was permanently deleted because I got into a little bit of a politics.
By
Instagram.
By Instagram.
It said, I got a message the next day. It was permanently deleted for some political opinions. So we do get shut
For
down.
political opinions, not for medical opinions.
Not because of, which is fascinating. And I'll tell you why that's fascinating, because often people are claiming that scientific ideas are being silenced. And then they use the tools, and we actually did a study on this in the context of, different topic, a very controversial topic, health space. And we found that the idea that these ideas were being silenced was completely false. In fact, they were dominant narratives in the public discourse. They're on the world's most popular podcasts. They're on the most popular cable news shows. They're talking to politicians all over the world. They haven't been silenced. We should all be so silenced, right? But that narrative is incredibly powerful, and it's impacting our ability to regulate the social media platforms, right? So I think that's really important. The other thing is the idea that there's some kind of bias occurring, and that's something else that Zuckerberg, and that's also not true. There was a study that came out just last week that highlighted the degree to which that's not true, that there's some kind of bias in who gets silenced. And there's been studies that have come out prior to Zuckerberg's claim that have also shown that's just simply not true. So yeah, the social media platforms have to do more. We need more fact checking. And we also need, I think, more transparency around the algorithms. How are these algorithms built to create the incentives that lead to all the problems that we're talking about?
So in just a little while, I want to come to questions from the audience. So I want to give you a notice to get some good questions together, keep our gurus honest. Before we do, though, I want to do another round, picking up on your hockey reference, my sympathies to our friends from the North. I'm reminded by that famous quote from Wayne Gretzky, who said, what's the secret to a success? I skate to where the puck is going to be, he said, right? And in that way, I want to cast our conversation to where we should be going in the future in dealing with this challenge, and ask my experts here, how do we deal with the next disruption? How do we deal with what comes next? How would you recommend that we be a bit proactive? And Alison, I'm going to start with you, and a bit of context for our audience. You were at Weight Watchers for a number of years, and a science-based organization, I think over 130 peer-reviewed studies that you've done, disrupted by the tidal wave of medical innovation, but also social innovation and media innovation. Can you give us a sense of having gone through that experience, and when was it apparent that it was going to happen, but also what comes next, and what should we be preparing for?
Yeah, I think it's, you always want to be able to read the tea leaves, but I think particularly in the obesity space, we've known, GLP-1s, for example, right now feel brand new. They're not brand new. People have been taking medications for obesity for quite a long time. People have been using surgical interventions for obesity for quite a long time. I remember when I first started working at Weight Watchers, which is has done a lot of wonderful things. I'm no longer there now. I remember talking to folks about, what about medical interventions for obesity? What about surgical interventions? And it was almost like those didn't exist. And so I do think that we need to look at what's happening today, sort of the grumblings, the interest that people have, the challenges that they're having, and know that they are not going to go away. But more importantly, the solutions that people are looking at. I think we need to really understand the motivation that is driving folks toward those solutions. I hear a lot of people saying, a lot of frustration on the part of the psychology community, the medical community related to obesity, that, for example, folks like influencers have so much of an impact. And I always think, gosh, but what can we learn from that? Right. So, or even, compounding with GLP-1s, et cetera. What can we learn from the fact that there was such an interest or drive toward that there's a need, there is an interest, there is a demand. And so let's pay attention to that and use that to get ahead of ourselves. Yeah.
How about you, Rhonda? What would you look to the future, the next disruption? How do we get ready for it?
This space is going to explode. I was just at a medical conference this weekend. There are so many medications to help patients that are coming. I think my biggest thing is, we need to continue to fight. If it's fight to get the right education out there, and everyone needs to do their job. So pharma, advocacy groups, healthcare professionals, etc. This isn't about one group doing their job. It's about all of us collaborating to continue the fight of getting truthful medical backed information out there. Because I do feel that it's just going to get more confusing for patients, and then even more people coming into this space to create more and more noise. We need to continue the fight.
So you see an intensification of the trends we've already seen thus far.
I say absolutely.
So the response has also got to step up, is
Yeah.
what I'm hearing. Yeah.
Yeah, exactly.
What do you think?
Yeah, I think as we were mentioning before, social media is here to stay, and this is just the beginning. And I have two daughters. One is 9 and one is 10, and they are on social media, right? As much as I want to regulate how much they see, it's I imagine like when the TV came out back in the 1940s, right? It's social media, internet, the same thing. It's here to stay. And I think if we use it the right way, it has really positive effects. And I think in the space that I work with, which is obesity and menopause, perimenopause, it's been great. And I see so much positivity on it, at least with the people that I relate of my colleagues that are doing it for the right thing, right? We're debunking misinformation and empowering women to take control of their health, and patients with obesity also, right? I feel there's been those two populations that we've not paid attention enough. So social media has been really a good outlet for women and people struggling with obesity to be able to get the information that they deserve. So I'm a positive, and I think it's going to become a great source of information.
Tim, a final word on the sort of the puck racing ahead?
Yeah, we haven't even mentioned the word AI.
Yeah.
Not really, yeah.
Yeah, the words. I mean, it's for sure going to have a massive impact. Again, I think it's important to highlight both good and bad. Like we shouldn't, and it's not going away, right? It's going to be here. It is here. It is here.
Yeah.
There was a study, again, very, very recent, I think it was done actually in Canada, looking at AI, using AI as a diagnostic tool online. Only 31% accuracy. 31% accuracy. Now, whenever you talk about AI, you have to be very careful because the technology is moving so quickly that by the time that study comes out, the technology has changed. But we also have to recognize that AI is going to be able to create, and studies have demonstrated this numerous times, fake studies that look real instantaneously, right? Then they create a fake news release about that study instantaneously. Then they make fake social media content. So even if you take the time to click through, you're the 25% that clicks through, you're going to be met with this nonsense. I mean, looking at an abstract on is more than you could ever hope for. So, to have a patient or even clinicians do, right? And so I think this is going to create a real challenge. The other huge challenge is fake science, bad science, predatory journals. Again, it is polluting the scientific literature. So these are the journals that are either outright fake, they're just vanity journals that look real, or they're predatory journals where someone is just paid to create a study that looks real. Again, it can be incredibly deceptive to the media, to patients, to the public, but also, again, to clinicians. And the last thing I'll say, and this is maybe the most worrisome, is the degree to which everything we're talking about is becoming political. And again, I'm not saying that for partisan reasons, but research tells us once a topic becomes part of your personal identity, part of your psychology, your image, very hard to change people's minds. There's a study that recently came out that talks about it becoming sticky. And also the rhetoric around that topic becomes more noxious, becomes uglier. And of course, we've all seen that play out.
I want to say that, and to bring to the point, is like many times you see somebody put a reference of an article or of a journal. It's so complex, even as doctors, to really know what the study does, right? What were the incentives? Is it a journal, a serious journal? I think that nothing that you see out there will ever replace the medical training that we doctors have. Yeah. It took me 14 years of medical training to become an endocrinologist, right? So again, our credentials should still have credibility. I have 14 years of training, 15 years of working in clinical practice. I have 29 years of that influencer that shows you papers or journals. You still have to believe in healthcare and physicians, right? Because that training, nobody's going to take it away from us. So it's not just you putting us next to a journal, next to an influencer, next to a chiropractor that now thinks that's read all these articles. Nothing will replace my 14 years of training and 15 years of clinical
You
experience.
need that judgment, don't you, that your experience and training brings.
Exactly.
VJ,
Still
can I comment
has a
on that real
weight.
quickly?
Yeah, sure.
I couldn't agree more. I
Yeah.
couldn't agree, because there's a paradox that's emerging right now. At the exact moment in human history where we need experts, they're being devalued, right?
Exactly.
You know, and it's a real problem, I think, with our knowledge economy right now. There's smear campaigns, and also this idea of scientific consensus and the body of evidence is also being devalued at the exact moment we should be looking to these things. So I couldn't agree more.
And even if it's not from, say, malicious or self-interested actors on social media, how many of you have used AI deep research tools that have out there? Almost everyone has tried them, right? There's multiple companies, and they're getting better. Every 3 months, there's a new model that gets deeper, and the reports are presented very authoritatively, aren't they? I mean, you really feel like, wow, I know everything I need to know about whatever topic. But if you happen to know something about the topic, as you do on your topic, given years of experience and practice and study, you can quickly spot that, the prompts that you gave maybe had a bias inherent in them, or the document search, and you dig through the sources and the reasoning, and you find that it's amateurish, and there are huge gaps, and they get led by giving inappropriate weight to either false or lightweight sources, and not enough weight to credible sources. And that's what judgment brings, right? As a journalist, I experience it myself. Every time I use these sources, and I try all of them for the purposes of getting to grips with new tools. And though some things are pretty amazing, for a quick and dirty sort of look at something and enough to give you a pointer to go chase it up yourself. But if you stop and you don't chase it up yourself and do your own research and then talk to an expert or a series of experts, then you could really be led down the garden path. I think that's what and with health, that's the last thing one wants, right? I had promised to come to the audience, so let's see. I see a quick hand in the back. I think we do have some microphones. Just a ground roll, please tell us your name and affiliation and make it a good question.
No pressure. I'm Deb Whitman. I lead policy research and international at AARP. And most people don't realize that we're a communications company. We have the most read magazine.
Hold your mic a bit closer, please.
We have the most, I work at AARP, and most people don't realize we're a communications company. We have the most read magazine. We have millions of hits on our website. And I think to the time of COVID, where we really relied on the CDC as a source of scientific consensus when we were communicating with our members and people. And I worry a little bit about where we find the scientific consensus today, and where our reporters and others should be looking. It's hard to do every doctor individually. And as you said, there's so much misinformation with the science. So when we're looking to communicate to people, where do we find the evidence, and where are the trusted sources that people should be looking at today, particularly in the
Great question.
polarization?
So who wants to jump in on that?
I could talk. I'm very interested in the concept of scientific consensus. There's been some really interesting studies very recently that have shown that the general public often doesn't understand what the scientific consensus is. It's not a memo we get from the Star Chamber to say this is the new meta narrative. It's hundreds of studies that kind of point in a particular direction. It's constantly contested. It moves forward iteratively. And studies show that if you explain that to people and tell them what the scope of the consensus actually is on a topic, you can shift opinion and behavior, which is really fascinating. And they've done this with vaccines, with climate change, with GMOs. So your point is incredibly important. And also your point, so 5 years ago, as you can imagine, I used to get this question a lot from the media and from the general public. Go to the CDC, go to Health Canada, go to the FDA, go to the FTC. It's getting more difficult to do that. And so I really do think that I think that there are entities like Health Canada, there's public health entities that I think are doing a fantastic job. Public Health Ontario is really good on social media. So there are entities that you can find and you can still point to. And I think we also need to support and encourage, as we're starting to see happen organically, the growth of organizations of respected experts that are going to aggregate the science in a responsible manner. And we're starting to see that happen in the United States. And there are other entities. I believe Durham University in the UK is going to create a center for scientific consensus where they get a sense of what the scientific consensus is. And so that'll be information for the public, for the media, but also for experts. And if I could, one more example.
Yeah.
I have a colleague at the University of British Columbia who created the Clarity Foundation, and he does this in the context of health topics. He just did one on childhood vaccination where he surveyed all the pediatricians in British Columbia and asked them, are childhood vaccinations safe and effective? What percentage? 100% of pediatricians agreed with that. And I can guarantee, even in Canada, the public doesn't know that. So scientific consensus matters, and creating organizations and supporting organizations that aggregate it responsibly matters a lot.
I saw a couple more hands. Let's go to the gentleman near the front. We have a microphone coming, sir.
I shouldn't argue with the guy.
Please identify yourself.
Jeff Thompson from Gunderson Health, but I would say the pediatricians, as a pediatrician, would say the question should be asked are they 100% of the pediatricians would say they are safer than not being vaccinated? Because the pediatricians know the science and know that 1 in a gazillion kids will have something, but those of us have seen kids with measles vomit up, cough up chunks of lung, would say vaccinations are safer. And also in response to the question, the societies like the American Academy of Pediatrics is generally a good source. Don't go to the big chat GPT answers. Go to a source like that. Go to the New England Journal. Go to the British Medical Journal. They're not perfect, but read the source from good clinicians that have done hard work. My question is, how do we approach the people that have the biggest problem that are often left out? Some of the people that cause the problem, I didn't hear much about agribusiness. Pharma, I know they're sponsoring this, but sometimes some pharma companies are pretty self-promoting and a little loose with the science. How do we address the indigenous populations, the populations of color that are statistically really affected more than the other? And then as a pediatrician, pediatricians now have to be taught how to manage early stage renal failure and type 2 diabetes, because children that are obese at 5 and 7 are in desperate shape by the time they're in their late teens. So how do you respectfully approach a family to try and not put it all on them, but you're staring at a child and you know the data. If this 7-year-old, 5-year-old doesn't get a handle on their obesity, and the drugs aren't being used much for little children these days, they're guaranteed to have a lifelong health limiting, financial limiting, social limiting disease.
So GLP-1 medications are approved for 10 and above for type 2 diabetes and 12 and above for obesity, right? My practice, after seeing thousands of patients, I've seen patients in every decade of their life, right? And when I see patients in their 40s, 50s, 60s, there are patients that struggle with weight since childhood. The first question that I ask all my patients with obesity, and by the way, we use people first language. We don't say the obese people, the obese kid. We see the kid with obesity. People are not their diseases, same with diabetes, not the diabetic as people with diabetes, right? So people with obesity, I always ask them, at what age were you conscious about your weight? 7, 9. I was on my first diet at 10 by my mom, by my school. But if we can relieve from the mental health, the physical health, the psychological health burden of obesity, why can we not do it at younger age, right? When we think of, oh, this is such a strict, such a drastic treatment, we should talk about food. We never talk about obesity medications without talking about nutrition, about exercising. If you go to somebody that they're not talking to you about nutrition and exercise, go to a different person, right? They have no clue on how these medications and how obesity works. So if we tackle early on obesity, we're going to have individuals that will be more successful, mentally, psychologically, less burden to the workforce, to the healthcare system, right? So again, we have to think of obesity as a disease, because if we're thinking about something cosmetically, thinking, oh, you should not look like this as a kid, you should look like this, then of course people would think it's crazy. Why are we using a drug to treat for somebody to be thin outside? But it's not about that. It's about your health. It's about your sleep. It's about your heart. It's about your kidneys. It's about not developing diabetes. So first, as a society, not just as the general population, but as the healthcare society, we need to understand that obesity, it's a healthcare problem. It's a disease. And when you see it like that, we don't question the use of a medication. We don't question the use of somebody starting diabetes medication, hypertension medication. Yes.
Let's get 1 second. The microphone's coming. Yeah. And please identify yourself.
My name is Vicky. I'm a nurse at Aston Valley Health here in town. My question is, these are all things that we're looking for children and adults, but the biggest question in this country is, how do these people access these type of services when we are in a profit or for-profit healthcare system? You see that most of these GLP-1 medications now cost over $1,000 a month. And so how are we gonna help the people that have less accessibility to access providers or information in social media or in the internet that is actually credited and not
That's just a powerful question. Let's hear from the panel on access.
Yeah. I'm sorry. We have to start with education too, right? We have to educate people that it's an investment. How much money do people invest on diets, on training programs, things that don't work? I think education. As there are going to be more different type of medication, I think the monopoly of the two big pharmaceuticals that have now, that is also going to reduce the price, but a little, somewhat.
Rhonda, you've had this question before. How do you deal with the challenge of access?
I kind of went there with one of the questions. I think access is the #1 priority. I don't think it's just one of us. It's not just pharma. I think that's what I'm saying. It's this collaboration. We're working really hard to get access. And I think what you're saying too, like.
So that's insurance companies, that's public policy, that's
Yeah,
Medicare.
it starts with policy,
Yeah.
#1. And, actually acknowledging this as a chronic disease. And having coverage. And so once we kind of get policy there, everything, I believe, trickles down. I think you kind of alluded to Medicaid access, state access. And so we're also trying to work with states to get access to these great medications for patients in a population where they don't have access to everything you're saying. So we're continuing to do that. I always say we're not in this alone. It takes advocacy, it takes healthcare professionals, but we are continuing to work with government policy and states and I think you're going to payers, et cetera. But we're continuing to try to get access and continue that access for these medications.
What is interesting is when you look at this question from a global perspective, there are other countries that use tests of cost benefit, for example, in determining access and reimbursement. UK, for example, with the NICE agency. And the more evidence is coming in, these are, again, rapidly exploding usage, but more evidence of co-benefits, not just in terms of weight loss, but multiple health benefits across this particular category of drugs. You're seeing more willingness to pay from regulators in other countries as they see more benefits to using these drugs over the longer term. Now, what's the ultimate end game? What's the right regulatory regime? I think that'll vary by society to society. Canada has a different approach than we do in the US. But thank you for the great question. I see a hand in the back. If we can get a microphone there.
Bree Tomlinson. I work for an advertising and communications agency. My question is, I think, more to you, Timothy, around research. And when I love the question about where the future is, and I do agree with you, it's on the AI side. And if we think of open AI and how people are using that as their first point of entry to educate themselves on ChatGPT, how are we able to penetrate those areas with correct information outside this social media kind of ecosystem that we know influencers are important, paid media is important, but how do we get to them at that first point of entry there with correct information that is funneling through? And if you have that, if you don't have any research on it,
it's too hard.
but I know we don't have that answer yet, but is there research?
A quick short answer,
into
Tim,
that?
or else.
It's a great question, extremely difficult. Look, fighting misinformation is difficult, and it's difficult enough when you're just trying to debunk and correct stuff. It's more difficult when you're kind of wrestling with an algorithm that's creating content for people, right? So we have a research project right now on something VJ talked about. You know, how accurate are the references that are used? The good news is a lot of research, I think, is going on, both in an academic sense, but also with, you know, the platforms and the tech companies on this topic. My fear is it's so easy to manipulate, right? And we've already heard about that with some of the platforms, you know, manipulating their AI answer. I think you've identified something that is crucially important. We also know that the younger demographic are leaning heavily on this platform. So I think this is a priority.
So Tim, we're going to put a pin in that and watch the research here. And I encourage all of you to follow his institute. Final question. Let's make it a quick, sharp question and a quick answer, just in interest of time.
Hi, everyone. I'm Molly McCarthy. I'm a nurse. I spent 10 years at Microsoft, and I'm a visiting professor right now at Villanova. And I'm just curious, this was an amazing discussion. The one missing piece that I don't hear mentioned today is just the food industry and how that all plays into this, because, you know, a 5-year-old or a 7-year-old who might be predisposed through genetics to obesity. The other big missing piece, I think, is the food industry here in terms of ultra processed foods, et cetera. And I know that we don't have enough time to discuss that, but I just wanted to
ask for a quick question. You've opened up an entire Pandora's box of agribusiness and the food pyramid. We can go back a long time in history. Does someone have a quick thought on this?
Okay.
Just in fairness, yeah.
I would say the food industry one day will be held accountable as the tobacco industry, number one. Second, the food industry is a multi-billion-dollar production company. So to tackle that is going to take a few generations, unfortunately.
Thank you. Thank you. We're not doing justice to the question. Obviously, that's worthy of its own session. Note to my colleagues, maybe we could pursue that as a future initiative and line of research. But of course, it's a powerful aspect of the conversation. We've just run out of time, so I'm going to draw our session to a close. It would be impossible to summarize the richness of this conversation, both from the floor in your questions and especially from our speakers. But I think we got a few key points here that there is a real societal challenge, and it is going to get worse before it gets better. Certainly the trend lines are heading in that direction. But I hope you've also taken some hope, inspiration from our experts and practitioners, because there are people working on this as well as practices. They're advocating, you've heard a few of their ideas, but also what each of us can do in our own lives. Taking a breath, not amplifying, and encouraging the people in our lives who might be the most vulnerable, be that people who are young women and girls, or those susceptible to the manosphere. Put on a shirt, you know. don't just follow what that guy on your podcast is telling you to do. But nevertheless, be more thoughtful and look for experts, look for credentials. Take a moment. This is good sort of social media hygiene for all of us on all topics. But when it comes to health, it's so vital to our future that we encourage you all to take that up. I want to thank our organizers from Economist Impact. I want to thank all of you and our sponsors at Lilly for making possible this conversation, and our audience joining us online. Please give a nice round of applause to our speakers, and we'll see you next time.